Welcome to this video that explains the stages of AI-enabled EHR admission workflow. The text was compiled by Dr. Sandy Sandbar. The video was developed by Tyler Sandbar and narrated by AI, with gratitude for help by Microsoft Copilot. The integration of artificial intelligence, AI, into electronic health record EHR systems is reshaping the hospital admission process. A simplified model highlights four core stages, namely intake, admission, therapy, and discharge. An expanded professional version must also account for pre-intake, diagnostics, compliance, and post-discharge continuity. Each of these stages carries distinct clinical, regulatory, and ethical implications. This presentation explains each step in detail, with attention to how AI can enhance efficiency, accuracy, and patient safety while meeting compliance standards. First is the pre-intake, which includes referral, records, and authorization. The hospital journey often begins before the patient arrives. Pre-intake includes referral from a primary care provider, transfer from another facility, or self-initiated contact. At this stage, AI can streamline the gathering of prior medical records, imaging, and laboratory data through interoperability tools. Natural language processing, NLP, can extract relevant details from unstructured documents, while predictive algorithms can flag missing information. Insurance verification and pre-authorization are also critical. Automated eligibility checks reduce administrative delays, and AI-driven fraud detection can identify inconsistencies. Consent capture, whether for data sharing, procedures, or research participation. Benefits from AI-enabled language translation and readability scoring, ensuring patients understand what they are signing. This stage sets the foundation for a smoother admission by reducing bottlenecks and ensuring compliance with payer and ethical requirements. The next step is intake, which includes demographics, triage, and patient engagement. Once the patient presents to the hospital, intake involves collecting demographics, chief complaints, and initial triage data. AI-enabled kiosks or mobile apps can guide patients through symptom checkers and questionnaires, standardizing data entry and reducing clerical burden. For diverse populations, AI-powered translation tools and adaptive interfaces ensure accessibility. Ethical safeguards are essential here. Algorithms must be transparent and free from bias, particularly when triage scores influence prioritization of care. Integration with patient portals allows individuals to 1. Update their information, 2. Review privacy notices, and 3. Engage in shared decision-making from the outset. Intake is therefore not only administrative, but also the first opportunity to build trust and inclusiveness. The next step is the admission, which includes the history, physical, and risk stratification. The admission phase traditionally centers on the history and physical examination, H&P, and formulation of a differential diagnosis. AI augments this process by suggesting 1. Structured templates, 2. Auto-populating sections from prior records, and 3. Highlighting gaps. Clinical Decision Support Systems, CDSS, can generate differential diagnoses based on presenting symptoms, past history, and population-level data. Risk stratification tools powered by machine learning can predict likelihood of complications, length of stay, or readmission. From a compliance perspective, AI can prompt clinicians to document required elements for coding and billing, ensuring alignment with ICD-10 and CPT standards. Properly designed, these systems reduce physician burnout by minimizing redundant data entry while enhancing accuracy and regulatory adherence. The next step is diagnostics, which includes labs, imaging, and AI interpretation. Diagnostics represent a critical addition to the expanded workflow. Laboratory tests and imaging studies often drive therapeutic decisions, and AI is increasingly central to their interpretation. Algorithms can detect 1. Subtle radiographic findings, 2. Flag abnormal lab trends, and 3. Prioritize urgent results for clinician review. It is extremely important to keep in mind that AI does not replace human judgment, but acts as a second reader, improving sensitivity and reducing oversight errors. Regulatory frameworks such as FDA clearance for AI-based diagnostic tools ensure safety and reliability. Integration into the EHR allows results to flow seamlessly into the clinical narrative. While audit trails document how AI contributed to decision-making, This transparency is essential for medico-legal defensibility and CME teaching. The next step is therapy, which involves planning, medications, and interdisciplinary care. Therapy encompasses the formulation and execution of a treatment plan. AI can do the following: 1. Synthesize guidelines, 2. Patient specific factors, and 3. Predictive analytics to recommend evidence based interventions. For pharmacotherapy, medication reconciliation and interaction checks are enhanced by AI systems that cross reference vast drug databases in real time. The next step is therapy, which involves planning, medications, and interdisciplinary care. Therapy encompasses the formulation and execution of a treatment plan. AI can do the following: 1. Synthesize guidelines, 2. Patient specific factors, and 3. Predictive analytics to recommend evidence based interventions. For pharmacotherapy, medication reconciliation and interaction checks are enhanced by AI systems that cross reference vast drug databases in real time. The next step is the compliance layer, which includes documentation, billing, and quality metrics. Compliance is not a discrete step, but a layer that overlays the entire workflow. AI can assist in 1. Real-time documentation audits, 2. Flagging missing signatures, incomplete fields, or discrepancies between narrative notes, and 3. Coded data. Keep in mind that automated coding suggestions reduce errors and support accurate reimbursement. Quality metrics include adherence to sepsis bundles or timely administration of antibiotics. They are tracked automatically, feeding into hospital performance dashboards. Audit trails ensure that every AI recommendation and clinician response is 1. Logged, 2. Supporting transparency and regulatory review. This layer illustrates how clinical care and compliance are inseparable in modern practice, and how AI can reduce the tension between them. The next step is the discharge, which includes notes, education, and transition planning. Discharge is a pivotal moment for patient safety and continuity of care. AI-enabled discharge summaries can auto-populate from the admission and therapy phases, reducing redundancy while ensuring completeness. Patient education materials can be tailored to literacy level and preferred language, with AI generating simplified explanations of diagnoses and medications. Predictive models can assess readmission risk, prompting additional interventions such as home health referrals or closer follow-up. Outpatient scheduling is streamlined through automated reminders and integration with patient portals. From a compliance perspective, discharge documentation must meet regulatory standards for transitions of care, and AI can ensure all required elements are present. The last step is post-discharge, which includes monitoring, telehealth, and outcomes tracking. The expanded workflow recognizes that care does not end at discharge. Remote monitoring devices such as wearables and home sensors feed data back into the EHR. AI algorithms analyze these streams for early warning signs of deterioration, enabling proactive outreach. Telehealth platforms supported by AI triage tools facilitate timely follow-up without requiring in-person visits. Outcomes tracking is essential for both quality improvement and regulatory reporting. AI can aggregate data across populations, identifying trends in readmissions, complications, or patient satisfaction. This feedback loop informs future care and CME curricula, ensuring that clinicians remain aligned with evolving standards of practice. In conclusion, the expanded AI-enabled EHR admission workflow illustrates how technology can enhance every stage of the patient journey. From pre-intake authorization to post-discharge monitoring, AI supports efficiency, accuracy, and compliance. For clinicians, the benefits include 1. Reduced documentation burden, 2. Improved diagnostic accuracy, and 3. Better coordination of care. For administrators and regulators, the workflow ensures 1. Adherence to standards, 2. Transparent audit trails, and 3. Measurable quality outcomes.